Assalamu alaikum. I am Dr. Farjana Khanam, Assistant Professor, Department of Anatomy, Bashundhara Ad-din Medical College. Now I am going to give a lecture about the breast anatomy. This is an important structure which is related to our human body, and it is one of the important criteria for mammals to breastfeed the baby. Mammary gland present in both male and female, but in male it is a rudimentary and in female it is a well developed structure. From this lecture we will able to know the shape and position of the female breast, structure of the mammary gland, blood supply of the female breast, lymphatic drainage of the female breast, which is very much important for these topics, and some applied anatomy which is related to the breast. Now, Latin word breast comes from the mammary. Mammary means to feed the human baby with the milk. So, Latin word breast comes from the mammary. It is a mammary gland. Now, we should remember that breast or mammary gland, it is a glandular structure, and it is a modified type of sweat gland, and it is an accessory organ of the female reproductive system. Accessory organ means due to this present it acts as a secondary characteristics of the female sex organ. Now let's talk about the situation and the extension. It lies over the superficial fascia of the pectoral region. This is very important line for the student. Breast lies over the superficial fascia. Breast ta thakche kothay superficial fascia upore. That's why it is a movable structure. Ekhon ei superficial structure er niche je structure ta thakbe seta hocche deep structure, that means deep fascia of the pectoral region. Ami abaro bolchi, breast lies over a superficial fascia. That's why it is a movable structure. Ei superficial structure ta kar upore thakbe? It lies just above the pectoral fascia, above the pectoral region. Extension, vertically it extends from the 2nd to 6th rib, and horizontally it extends from the lateral border of the sternum to the mid-axillary line. Now, deep fascia tar naam amra bollam ki? Deep fascia ta hocche pectoral fascia. So, in between the superficial fascia of the breast and the pectoral fascia, there is a space that is called retromammary space. আমি আবারও বুঝিয়ে বলছি, এই যে সুপারফিশিয়াল ফাসা অফ দ্য ব্রেস্ট বা ব্রেস্ট এবং পেক্টোরাল ফাসা মাঝখানে একটা স্পেস থাকবে, তাকে আমরা বলতেছি retromammary fascia. Here is a picture that showing extension of the ribs from 2nd rib to 6th rib, and the structure and the muscle present just behind the breast, that is the pectoral fascia, then pectoralis minor muscle, then pectoralis major muscle. Now here is another picture showing the shape and position of the breast. There is a 2nd to 6th rib extension, pectoralis major muscle, skin and fat. In this picture we can see some structure of the breast. Here in from above downwards it consists of epidermis, lymphatics, dermis, Cooper's ligament, that is the main structural anatomy of the breast, then breast lobules, then breast duct, lymphatics, retromammary space and fascia. Upper lateral quadrant of the breast has an extension that is known as the axillary tail of the sphinxes. আমরা আবার একটু বলি, আমরা একটা ব্রেস্টকে যদি চারটা ভাগে ভাগ করি, if we divide the breast into 4 quadrant, that is upper medial, upper lateral, lower medial and lower lateral. Upper lateral quadrant has some extension to the corresponding axilla, that is called axillary tail of sphinxes. It pairs the deep pectoral fascia known as the foramina flagell. আমি আবার বলছি, it pairs the deep pectoral fascia which is known as foramina flagell. It has a direct communication with the anterior group of lymph node. আমি আবার বলছি, এই লাইনটা খুবই ইম্পর্টেন্ট. It has a direct communication with the anterior group of axillary lymph node. That's why we need to remove the axillary lymph node with the breast tissue, as it is a connection with the tail of the breast. Now, what are the structure of the breast? As we said before that breast is an glandular structure to present or to maintain the structure or to describe a structure of the gland, we should remember always that gland has two parts. One is parenchyma, second one is the stroma. What is parenchyma? This is the functional unit of a gland, that is called parenchyma. And a stroma, this is a supporting structure known as the stroma. For the breast, we can divide the structure into skin, parenchyma and stroma. Now, parenchyma, what is parenchyma? Again we say this is the functional unit. So, functional unit, that means some acini. So, lobules, ductules, lactiferous duct, lactiferous sinus and nipple. আবার একটু বলি, lobules, ductules, lactiferous duct, lactiferous sinus and nipple. Lobe, লোব জিনিসটা কি? লোব মিন্স 15 to 20 নাম্বার লোব আমাদের টোটাল ব্রেস্টে, ইচ ব্রেস্টে 15 to 20 in নাম্বার হচ্ছে টোটাল লোব আছে, কম্পোজড অফ মাইনর গ্ল্যান্ডুলার স্ট্রাকচার কল্ড লোবিউলস। আমরা আবারও বলছি, ছোট ছোট স্ট্রাকচার মিলে হচ্ছে লোবিউলস, কম্পোজড অফ মাইনর glandular structure called lobules. Lobules empty via the ductules in the lactiferous duct. তাহলে lobules and ductules মিলে হবে লোব, তারপরে সেটা যে শেষ হবে lactiferous duct, lactiferous sinus and nipple. Lactiferous duct এর মধ্যে কি কি আছে? সেটা হচ্ছে lactiferous duct directly open into the nipple. Just before opening, it has a dilated portion that is called lactiferous sinus. It contains the milk or reservation of the milk. So, in a glandular structure, it has two portions, that is the secretory portion, that is called acini, and there is some duct portion that is called ductules. The duct are the ductules, then lactiferous duct. So, again I repeat that each breast has 15 to 20 lobes. Each lobe is formed by the number of lobules. The lobes and lobules are separated by interlobar and interlobular fibrous and fatty tissue, that is called ligament of Cooper. এই জিনিসটা আমাদের খুবই ইম্পর্টেন্ট, ligaments of Cooper. আবারও বলতেছি, lobe and lobules are separated by interlobular and interlobular fibrous and fatty tissue called ligament of Coopers. These ligaments give the breast support by connecting the skin of the breast to the pectoralis major muscle below them. আবারও বলতেছি, ligaments of Cooper কি? এটা একটা কানেকটিভ টিস্যু. This ligament gives the breast supported by the connecting skin of the breast and to the pectoralis muscle below. It has 15 to 20 lactiferous duct that is open directly into the summit of the nipple. Now, here is a picture showing the basic structure of the parenchyma of the breast. The main formation of the milk occurs in the acini, then there is a ductules, then there is the lactiferous duct, lactiferous sinus, and that is the nipple. So, this is the main basic structure. Again, this parenchyma is a, তাহলে আমরা যদি গ্ল্যান্ডের টাইপটা একটু জানতে চাই ব্রেস্টে, দিস ইজ আ কম্পাউন্ড টিউবুলো অ্যালভিওলার গ্ল্যান্ড। আবারও বলছি, what type of gland it is? It is an exocrine gland, and exocrine glands একটা composition ছিল বা একটা component ছিল, it is a compound tubulo-acinar gland. আবারও বলছি, compound tubulo-acinar gland which secrete milk. These consist of 15 to 20 lobe. Each lobe is a cluster of alveoli and drained by the lactiferous duct. The lactiferous duct converges towards the nipple and open it. Near its termination, there is a dilatation that is called lactiferous sinus. Here is again a picture showing the lobules, lactiferous duct, lactiferous sinus. Then, now comes to the structure epithelium, structure or lining epithelium of the parenchyma. That is, the acini are lined by the cuboidal epithelium during the resting phase and columnar during the lactating phase. Smaller duct, usually simple cuboidal or columnar epithelium, and the larger duct, two or more layer, that is a stratified layer, and terminal part of the lactiferous duct by stratified squamous keratinized epithelium, that is the part of the skin. And now comes to the stroma. Stroma forms supporting framework of the gland. It is partly fibrous and partly fatty tissue. There is fibrous band that provide structural support and insert perpendicularly into the dermis terms as suspensory ligament of Cooper's. That's why involvement of Cooper's ligament causes risk in retraction. আবার আমরা বলি স্ট্রমা জিনিসটা কি? স্ট্রমা is a part made by the connective tissue. It supports the framework of the breast gland. It is partly fibrous and partly fatty. This fibrous band that provide structural support and insert perpendicularly into the dermis termed as suspensory ligament of the Cooper's. এই Cooper's ligament খুবই important because if any problem occurs in the Cooper's ligament that causes skin retraction. So this is all about the main basic structure of the breast.